Hi, my name is Kayla. I'm going to be your nurse for today. Today we're going to be doing an IV bolus with a compatible IV. Can I just have your name and date of birth? Okay, do you have any allergies? No, okay. I'm just going to check your IV, what's hanging. I'm going to write down that it's D5W at 80 milliliters per hour. The tubing looks okay. There's no kinks. I'm going to check the IV site right now. I already washed my hands. So the IV site looks clear, not swollen, not tender, not leaking, not red. Okay, after that, I'm going to wash my hands. I'm going to go to the Pyxis. So I'm going to get my chart, return to the Pyxis. Obviously, I don't have a Pyxis machine. We're going to open up our chart. We're going to open up the Pyxis. We're going to look for furosemide Lasix. And it says in our chart that we're going to give 20 milligrams IV every 12 hours. We're going to also check in our Pyxis that we have D5W hanging at 80 millimeters per hour, which we do. Okay, so we know that we need to do Lasix, and we know that we have D5W hanging. So we're going to return our chart. We're going to hand hygiene again. So we're going to wash our hands. Then we're going to go to our Pyxis. Again, I don't have a Pyxis machine. So we're going to compare the information. Okay, we know we're taking furosemide out. So on hand, it says we have 10 milligrams, but the order says 20. So we're going to take out one bottle. As you can see, I have my bottle here. Oops, there we go. So now we are going to take out our drug book, because we have to see if furosemide is compatible to what we are hanging. So we are going to look for dilution first. In our drug book, it says it may be diluted, it may be given undiluted. It also says it can be compatible with D5W. It is also compatible with normal saline and lactated ringers, but we have D5W hanging. And then we don't have to look at compatibility because we don't have meds in our bag. For rate of administration, it says it can be given over 1 to 2 minutes. We are going to give it at 2 minutes because it's safer to give over the allowed time. So after that, we are going to calculate our math to see how much we are given. So right here, we know that we want to give 2 mLs per 2 minutes. Half of 2 mLs is 1 mL. Half of 2 minutes is 1 minute. Half of 1 mL is 0.5 mLs. And half of 1 minute is 30 seconds. So we're going to be giving it at 0.5 milliliters over 30 seconds, the Lasix. So now we are going to need our 10 ml syringes. So we're going to go, we shut down our Pyxis. So everything's shut down so we don't invade the patient's privacy. Now we're going to get our syringes. So we're going to need 2 normal saline syringes. I already have my alcohol preps out. We have our and we also have our syringe for the Lasix. Oops. Ooh. so we're going to go into the patient's room. We're going to wash our hands. Again, we're going to ask for the name, date of birth, and any allergies. We're going to scan the patient's wristband. Okay, everything checks up. Okay. So now we are going to pull our medication out of the vial. So we're going to alcohol prep the vial. We already washed our hands. Again, we want 2 mLs. Okay, the cap's off. Alcohol the vial. Okay. We're going to draw back 2 mLs of air. Okay. Tip it upside down. And then we're going to draw back 2 mLs. Okay. We're going to flick it, make sure there's no air bubbles. Okay. We can also put a piece of tape that says this is LASIK so we don't get them confused with our normal saline syringes. So I'm going to put that sticker on there. Okay. Again, we have our alcohol prep pads for the normal saline too. We're going to just look at the normal saline. Make sure there's no air bubbles. Remember, we checked our LASIKs already with our chart. We made sure it's correct. We already asked the patient's name, date of birth, allergies. Okay, so now we're going to hand hygiene again, wash our hands. Because now we are getting ready to flush our site. We're going to need gloves. And we are going to be doing everything from the lower port. So remember, we have our LASIKs labeled, so we're not going to get it confused with the normal saline. We have our alcohol pad. Okay. So we're going to alcohol. You can see we're going to alcohol the lower port. Okay, we alcohol the lower port. I think you can see this. Okay, now we're going to inject 2 mL slowly while pinching. Okay, we did our 2 mLs. We're going to aspirate to see if there's blood. Sorry. And then we're going to push the rest of the 8 mLs in. Still while pinching the tubing. Okay. Now we're going to need another alcohol pad. We're going to administer our Lasix. So as we said, we're going to do 0.5 milliliters every 30 seconds. So we're going to need to use our clock. We're going to need to watch the second hand. Hopefully you can see. I'm going to clean the alcohol port again, the lower port. I'm going to grab our Lasix. Now we're going to do 0.5 milliliters every 30 seconds while pinching and unpinching. Until our 2 mLs are gone. So going very slowly, 0.5 while watching the clock every 30 seconds. Unpinch. Push it again, slowly. Unpinch. Pinch. Unpinch. Pinch. Unpinch. Pinch. Unpinch. Pinch. Unpinch. Pinch. Unpinch until we get rid of our 2 mLs. So now we're going to do our last flush. So we have to give up to 2 mLs of the normal saline of our last flush at the same rate we are giving the medication. So we're going to be doing it again, 0.5 in 30 seconds. All the way to 2 mLs, and then we're going to do the remaining 8 mLs after. So again, we're going to need another alcohol prep. Cleaning off the lower port again. And while we're doing all this, we're watching the IV site through this whole thing. Okay, we cleaned up the lower port. We're taking our last normal saline. Again, we're doing it at 0.5 in 30 seconds, so we're going to have to use our timer and look at our second hand again, all the way up to 2 mLs. So pinch, unpinch, pinch, unpinch, pinch, unpinch, pinch, unpinch. Okay, we have our 2 mLs, and then we're going to do the remaining 8 slowly. Okay. So now we're going to check our V-site. Our V-site looks good. We're going to clean up our mess. We're going to ask the patient if they need anything else. We're going to lower the bread, give the patient the call light. We're going to wash our hands, and we're going to document.